between substance, having a substance use disorder and like an actual diagnosable mental health disorder versus, essentially experimentation and or misuse, right? So somebody that has a more severe substance use disorder really cannot control the amount they take. They may have been using for a considerable period of time. They may be having physical withdrawal symptoms, may or may not have been in different inpatient facilities. But experimentation is much different. And for better or for worse, it's normal. It's a normal part of adolescence is that there's risk-taking and various in various ways, whether it be substances or in different ways. And so that in and of itself is not abnormal in adolescence. It's, in fact, experimentation is kind of developmentally appropriate. And however, the risks associated with that experimentation have changed. And that's not to say that there are a lot of psychological reasons that adolescents may be experimenting with drugs in the first place. It could be, trying to manage anxiety or depression. It could be trying to fit in with peers. There could be a number of different reasons that they're doing it, but we're at a time now with fentanyl in particular where experimentation is at a much greater risk. Again, there was certainly a time where people could experiment, or teens could experiment with drugs, and although it wasn't safe, it wasn't the best idea, it wasn't nearly as deadly. And so, that's what I wanted to kind of, differentiate first. And so when we think about fentanyl, most of us, I would imagine, assume it's the, fentanyl that's used to treat chronic pain. Many people that are receiving, cancer treatments or something like that, or have chronic pain, may be given a fentanyl patch, which it could have gel in it, or it could be something else, but that's not the type of fentanyl that we're typically talking about. And what we're actually talking about are two different, and it could be more than two, are different types of fentanyl analogs. And what an analog is it's basically a derivative of fentanyl itself. And so there's something called norfentanyl and carfentanyl. And carfentanyl in particular is incredibly deadly. And, give or take, depending on the amounts, can be 30 to 100 times more potent than traditional fentanyl. And one of the reasons that this is being found in various substances is because fentanyl analogs are much less expensive to produce. So many people that are selling drugs will utilize carfentanyl, norfentanyl, because it's a more inexpensive way to obtain the substance. So, and like many things these days, social media is playing a big part in this in a very real way, in particular Snapchat. And so essentially what's happening is that, and a lot of adolescents will, refer to it as, that I work with will refer to it, they have a plug that's on Snapchat, or a drug dealer that they've met on Snapchat. And, they may think they're buying a 2 milligram Xanax pill, or a Percocet, or, cocaine, or something like that, when in actuality, they may be buying a pill that's been pressed together to look like 2 milligram Xanax bar, to look like a Percocet, and in actuality, it's all fentanyl now, or mostly fentanyl and maybe some filler. Now, what's difficult about this conversation is I think a lot of us may have experienced DARE programs, various different methods of scared straight that are very fear-mongering and inaccurate. And really don't serve to do what its intended purpose. And that's really not what this is. When I'm describing what they're putting in Xanax or like what appears to be Xanax or some other type of drug, it really is fentanyl, and it really can result in a deadly drug poisoning, right? And the reason I say drug poisoning is that that is not the substance they're intending on buying. It's not the substance that they think they're buying. So it's a poisoning in the same way that anything else is. That is not their intention for kids or adults, generally. So So again, so yeah, going back to what they're using is Snapchat, and you know, somebody may post a story on Snapchat or send a direct message to someone, and they start chatting. They may or may not know this person, or maybe they have a friend that thinks they know them. But regardless, you know, the result is, and often the people that are actually selling the drugs on Snapchat, they don't really know where they've come from either, right? They don't know what they've been pressed into, and it could be another adolescent from the high school locally. But regardless, you know, they sell these drugs on Snapchat, and adolescents and adults can obtain them. And unfortunately, what can happen as a result of that is, like I mentioned before, is an accidental drug poisoning because it contains fentanyl. There's been multiple cases, you know, of this happening. There's even been various protests that have been organized outside of Snapchat for not doing more to stop this, right? And so this is a real problem. So so what that kind of leads me into next is, in my opinion, one of the most important things is to, you know, how do we talk with teens and adolescents about that so that they don't, you know, shut down. So I want to spend a little bit more time on what we've found is ineffective, which is, you know, the DARE scared straight type modality. And I don't know if you remember being part of that, but some of the, you know, the plays and the things that they would do in these programs were, you know, kind of silly and ridiculous, and you'd have to do this role play about like saying no to drugs. And, you know, unfortunately, what we know through research is that this doesn't work. The fear mongering doesn't work. The scared straight methodology doesn't work. And so, you know, approaching your teen or adolescents in a similar fashion is not going to work either. And so one of the most important things to do is to really try to establish that trust and rapport with your team before any of this happens in the first place, before they get into like experimentation with drugs. And I'm not sure if I think somebody might need to mute. I'm sorry. They could, I'm hearing a lot of background noise. But yeah, so the first thing you want to do is to try and have just an open, honest dialogue about that. So, and, you know, have the trust and rapport built with your adolescent, and then really start to just open up the conversation, right? You know, and because you know, when I say, I'm going to use a term called normalizing experimentation, right? And know that when I say normalizing, I'm not saying that is giving permission or encouraging or anything like that. But it's the fact that it is often a part of adolescence, and it's going to happen. So one of the conversations is, you know, how to stay safe as a result of that. And the honest response is that when, you know, when you're talking with your teens about the process of purchasing drugs online on Snapchat from someone you don't know, is that you cannot possibly know what the pills contain. And it's okay to give examples of what's happened before, but it's meant, but in having these conversations, it's really important to approach it from like a calm, you know, cool-headed perspective, so to speak, so that they understand that this is not meant to be a threat or another, you know, scared straight method. It's really just to have an open and honest dialogue with them. Is the best way to approach them. Now, it's very possible that, you know, you may get the standard response, you know, of, oh, you know, mom, dad, you know, I would never do that. Don't worry. I would never take something like that. You know, a lot of adolescents that I work with, they say, you know, John, I'm not stupid, right? And you know, please understand, this isn't, you know, a matter of, you know, intelligence in any way. And that's fine. If they say, listen, I would never do it, say, okay, but I want you to know that if you're ever presented with this, that these are the risks associated. So the research that they have found around drug education for teens and adolescents and early intervention is that what is effective is an honest evaluation of what the risks of the substances are, right? So, you know, for example, one of the things that I recall from DARE is they used to state that if you smoked, you know, one cigarette, you were instantly going to become addicted, and that's simply not true. That's not how, you know, nicotine's processed in the brain. So some of these fear mongering techniques are not helpful, but what is true about purchasing drugs from Snapchat or another, social media site like that is that they absolutely can contain a deadly amount of fentanyl, and that's not fear mongering. That's an honest assessment of what's going on. And so because again, like I said, that is often the rebuttal from adolescents, that they just deny that they would ever do anything like that, and just say that's fine. But you want them to know that if they were ever presented with the opportunity, that these are the risks associated with it. And just really keep that open dialogue for them to come to you, because the other thing is that there's and I do a lot of crisis intervention work, and I operate from a model called love first, right? So meaning you use love first in any type of way to intervene on a loved one, and you want to make sure you're always coming from a place of love and concern when you're having these conversations, and in some way for them to know that if they have experimented, or they might in the future, whatever it may be, that you're not coming from a punitive or punishing standpoint. You really just want them to stay safe, because although we're focusing a lot on adolescence, this is really not, it's not where it ends, right? Certainly there's the risk of experimentation in college, early adulthood, and again, there was a time where you could possibly experiment with a few different substances, although was the risk associated? Absolutely, but not in the same way that it is now. And these cases are becoming more and more common, and where parents are left pretty shocked and devastated, because they think, well, my kid never had a drug problem. There was, they really didn't. How could something like this happen? And the unfortunate piece is that somebody does not need to have a drug problem or be addicted to drugs, be a drug addict, and to use that terminology, to suffer an accidental drug poisoning that could potentially lead to death. That's not a requirement. So just having open and honest conversations with teens, not coming from a place of judgment, not fear mongering, and maintaining an open dialogue and checking in are all good methods. And certainly, if there ever was, more concerning behavior, to really, again, address it from a place of love and concern again. So I think that's mostly what I wanted to cover tonight, Michele. And
okay,
you can pass it along.
That was really excellent. We can open it to some questions before we move on to Beth talking about Birdie Light. Does anyone have any questions for what John was talking about before? We are going to have Beth talk and then Sharon talk about the test strips and Narcan, but anything else related to fentanyl that John was talking about that you have any questions about, feel free to unmute yourself and ask a question. I'll put it on I'll put it on gallery view. Or you can also put your question in the chat. Janie, I see your hand up. If you want to go ahead and unmute, you can ask a question.
Yes, I'm sorry I don't have my video on correctly, but
that's okay.
My question, because this just came up the other day, my question is regarding online purchasing and a bill that Congress is trying to pass to prevent online drug sales. The problem that I see is if we do that, then we're getting into that area of everywhere that we order online, maybe CVS, maybe Canada Drugs, all of these other situations. So I just wanted to know what your feelings were regarding legalities of ordering online.
Yeah, absolutely. So, I mean, what I can speak to predominantly is, I mean, I'm not really sure about, as far as other methods to order pharmaceuticals or prescription drugs or something like that online. But really what I'm talking about is what is more or less the counterfeit, for lack of a better term, pills that are being purchased, illegally via Snapchat or, perhaps some other type of social media. And they're not, again, I know I keep using the example because, Xanax is a very commonly misused and experimented with drug in high school. It's very common. A lot of adolescents that I've worked with use it, and these pills, like, although it'll look just like a regular Xanax, is actually pressed fentanyl. And so I don't know, like, as far as like bills passing in Congress, I don't think that regulating Snapchat and the ability to purchase that, because that's illegal even without the fentanyl.
Right.
It's illegal no matter what to purchase like prescription drugs in that way. So I don't know that it would really impact online purchasing from pharmacies or an online pharmacy or something like that.
Okay.
John, I have a question for you. I think it's so
Sure.
important for, parents to have these, open conversations with their teens. And this might be a silly question, but I'm sure people are thinking about it. If teens are inclined to purchase, these Xanax and Adderalls online, and we know that is a very risky thing to do, but we also want to be realistic and know that kids experiment and they do these things. What is the safest way to get their hands on this? If we know if we want to sort of not help them get it and not promote it or encourage it, but steer them away from that route of buying from these dealers online through these social media platforms.
Yeah, well, so I think, so what this kind of reminds me of, right, is like a conversation around, to relate it to sex education a little bit, right? It's like, there's one, sure way to not get pregnant or transmit an STI, and that's to not have sex, right? Abstinence. We know that often adolescents don't follow that, right? And similar to that, right? The best way to stay safe with any of this is abstinence, right? Is to not use the Xanax, is to not, use the pills. However, adolescents often, or, adults too, are not necessarily going to listen to that. So, having a conversation, around harm reduction, which I know Beth is going to get into later from Birdie Light, but I'll at least touch on, as far as like a safer way, right, would be to first of all know that it's actually coming from the prescription bottle, right? So to know that, perhaps like, if it was, prescribed by a doctor or, found in someone's medicine cabinet, and what you're taking is actually the pill that it is, and it's not carfentanil or norfentanyl or any analog of fentanyl. And that would be more of a way, and also to really like, to try and look at it at its authenticity. And I don't want to steal Beth's thunder later, but she's going to talk more about how you can see what's actually in it later on. And but yeah, so in general, that's what I would say, is that, really to say, listen, and just try and like explain it, just sticking to just the facts. When you're purchasing something like that from somebody you don't know, you cannot possibly know what's in it. Oh, mom, dad, I know him, like he's a good dude, like he did this, but you still cannot possibly know what's in it. So the safest way to just would be, to know what it's coming from. But keep in mind, regular Xanax or Percocet in and of itself is not without risks.
Right.
Objectively speaking, it's less risky than fentanyl or a fentanyl analog, but it's not without risks. I mean, and certainly the combination of a benzodiazepine, which is what Xanax is, with alcohol or an opioid or anything like that, can also result in drug poisoning and death. So and an overdose. So it's, again, there's no, like, the safest way is just not to do it, but I mean, really is to know what the source is, would be a way to stay a little safer. And
what about, I was reading recently that like people are getting their hands on vapes that also have some sort of traces of fentanyl in it. That's really scary too.
Yeah. No, actually, thank you for bringing that up, because I meant to discuss that. So, vaping in many ways, like nicotine vapes in particular, it's the new cigarettes, right? Probably the vast majority of the adolescents that I work with vape some kind of nicotine. I don't think any of them smoke cigarettes anymore. It's just not a thing. It was probably a thing when we were in high school, but they're just really not doing it anymore. And the problem with vapes is that, for those that haven't seen them, is that you can, if they're ones that are refillable, you can basically add anything to it, right? And so you can add, it could be, you can add THC oil to it, you can add different types of nicotine. And what's happening also is that when they're selling, and again, it's another place that people are buying the THC carts, right, or cartridges on Snapchat and other social media platforms. you know, it's not coming from a dispensary or anything like that. And it's being, you know, transacted and passed to various people and then eventually sold on Snapchat. It absolutely has contained, and I actually had a case recently where a kid tested positive for fentanyl after what he thought was just using a THC cartridge. And so why it's being added, it's the same reason it's being added to other pills, is because it packs a punch and it's inexpensive to produce and purchase. So.
Does anyone have any questions for John, or if not, we'll move on to Beth. If anyone has a question, please feel free to unmute or raise your hand. Carolyn, I saw your question in the chat. We're going to get to that later on. Okay, well, I don't see any hands up, so we'll go ahead and I will introduce, Beth is going to talk about her organization called Birdie Light. We are very honored and grateful to have her and her family on with us tonight. Thank you so much, Beth. Welcome.
Thank you, Michelle, for having me. And thank you, John and Sharon, for joining me. I want to thank everyone here, of course, for taking the time to come and listen tonight and to learn about Birdie Light. You know, every day of my life, I choose to honor my son, Eli Weinstock, and I fight in his name. And by coming here tonight, you've done the same, which is a great act of empathy and generosity. And I want to acknowledge that and thank you. I'm going to tell you the story of Birdie Light, which is a new story because all stories changed or started for us on March 2nd of 2021, when my son Eli went home to get ready to go out with his new fraternity brothers at American University. He had a 3.7 GPA and an internship lined up for the summer. We'd actually seen him in Boca just 10 days before he died. And Eli, like John mentioned, Eli did not have a substance use disorder. He was focused on his future. He was hanging out with his friends, and he was making future-oriented decisions every day, 99% of them the right decision. Within an hour of arriving at his home near American, he had died from an unintentional fentanyl ingestion. He was poisoned by fentanyl. He collapsed in his shower. Eli was murdered, and the murder weapon was fentanyl. Now, I want everyone here to reach back into their memory vault into the 2 decades between the ages of 15 and 35. And I want you to think of the 1% to 2% of your decisions that were bad ones. Was it acid at a Grateful Dead show? Was it driving after the 2 to 3 beers you thought were okay? Was it a line of cocaine in the wild 1980s, magic mushrooms, a nickel bag of weed? Well, here we are in 2022, and the landscape has changed, and the waters around our kids are poisoned. In 12 months alone last year, 100,000 people died of what's labeled an overdose. This is the highest number ever recorded for drug-related fatalities and the highest percentage increase ever recorded over a 12-month period. And over 70% of those deaths were due to fentanyl or fentanyl analogs, as John mentioned. Compare this to 2015, not that long ago, when 15% of all overdoses were due to fentanyl. And I want to be clear that Birdie Light prefers not to call these deaths overdoses. To use the word overdoses is to imply that the person using the fentanyl was accustomed to using or dosing the fentanyl regularly, and that on the day of their death, they took an overdose. In reality, the vast majority of people who die from fentanyl ingestion have no idea they're taking fentanyl that day. We prefer to call them poisonings or adulterations. Let me make a couple striking comparisons for you. At the height of the AIDS epidemic in 1995, about 42,000 people died in 1 year from complications of HIV at the height of the epidemic. Compare that to the over 70,000 just last year to fentanyl. Another comparison, on the Vietnam War Memorial Wall, there are 58,000 names for an entire war. The fastest growing increases of this epidemic are seen in males aged 15 to 24 and in the Black, Latinx, Native American, and Asian American communities. But overall, a 30% increase across all ages and all demographics. So Birdie Light argues that this is the greatest societal crisis of our children's generation. The magnitude of this loss is hard to convey. And we don't lose this many young people per year in wars, in car accidents. Nothing gets close. Currently, fentanyl is the leading cause of death in Americans age 18 to 45. So what does Birdie Light do? Our organization plans to create major social change. We're determined to change the way people think about fentanyl. Fentanyl poisoning is unacceptable and criminal. And if we're going to admit that some people ingest, smoke, or inject illicit substances on a regular basis, or if we're going to make the assumption that young people from time eternal have experimented with ingesting, smoking, or ingesting substances, then we have to also admit that we can't stop people from trying things. It doesn't work to only tell kids to not do drugs. The numbers don't lie. But people who try things don't deserve to die. People who use cocaine once a month don't deserve to die. College kids who do a line of cocaine for the first time on the rooftop of their apartment while watching a football game don't deserve to die. That happened in August to a recent college graduate from Cincinnati. A kid who orders a fake Xanax from a friend he met on Snapchat doesn't deserve to die. And a kid who asks a friend for an Adderall to study all night doesn't deserve to die. So how do we stop it? Other than marching and rioting in the streets about this crisis, the next best thing is education and empowerment. Although sometimes I prefer to march and riot in the streets. Birdie Light's an educational initiative with the dream to get a fentanyl test strip in the hand of any American young person who needs it, to make a cultural shift, to take the discussion of fentanyl out of the dark places such as needle exchange programs and recovery programs and move the conversation into the mainstream. What we're doing, in short, is we're trying to save your kid's life. We aim to be the gold standard by which the children of this country are educated about the fentanyl epidemic. So we go to campuses, we go to high schools, we speak to groups of young adults and parent groups and camps and really anyone who will listen to us about the dangers of fentanyl, where it's found, and how to test for it. We teach them about fentanyl test strips and distribute them when we're able, and we talk about the importance of Narcan as a reversal tool, no matter what drug you're trying. And we talk about all the pills that John mentioned. We talk about fake Xanax, fake Adderall, fake oxycodone. We talk about cocaine, ecstasy, methamphetamine, among others that all contain fentanyl these days. And we teach them individually for each drug how to test each one, depending on what form it's in, whether it's a pill, a powder, or a residue. And then we talk to them about what happens in their body when you take fentanyl and how little of it is lethal. So I want you to think about other cultural shifts that have occurred in our lifetime. So think about the designated driver that we learned about. It became, because of Mothers Against Drunk Driving, almost a point of public shaming if you drove after drinking. And Mothers Against Drunk Driving accomplished that. And then what about condoms? In the late 80s, we were already talking in high schools and dorms about condoms in very candid ways, only 5 years after the AIDS epidemic started. That was a cultural shift also. So what we do to make this shift happen is that we talk to everybody. We partner with harm reduction groups, departments of public health, the DEA, health educator, and other community organizations. And we talk to school administrators about the real problem, and we encourage them to have frank and open conversations with all the kids in their schools, in the hopes that everyone will pass this information along and then pass the strips to their friends, and perhaps parents will pass the strips to their kids. So here's our message to your kids. We know most of you are going to try something. If you're like the over 80% of young people who do try something, we want to train you to pause, take a deep breath, test your drugs, make an informed decision. Always tell someone that you're using something so that they know about it and that they know where the Narcan is. And we want you to always tell your friends who are about to use something to test and always know where the Narcan is. And we want to tell this to every kid in America. So I think, our kids have enough to worry about. What if we could arm them with information and a tool So this is one less thing that they can't control. And I'll stop there for any questions or comments.
Beth, can you explain as well? Thank you so much for sharing your story, and we are deeply sorry for your loss and grateful that you are turning that loss into helping preventing others from this. So thank you so much.
Sure.
Can you explain a little bit, so for people who don't know, how these test strips work? Like so people just a little bit know about that, and what Narcan is as well?
Yeah, actually, I have a strip right here. Let me grab it.
And if anyone has any questions or thought or comments to Beth, you could put them in the chat as well. Thank you.
So this is the package of the strip. It works like a common pregnancy test. And whatever drug is about to be used needs to be dissolved in liquid. So for example, we tell young adults if they're going to use a pill, they should dissolve the whole pill in the equivalent of a small, like a shot glass or the top of a 2-liter soda bottle. They put the water in there. They dissolve whatever they're about to take. Let's say it's a fake Xanax. And then they dip this strip into the liquid. And they let it sit there for 30 to 60 seconds. Then they lay it flat on a surface, and then they watch for a positive or negative result. The whole process would take 2 to 3 minutes. And it gives you a positive or negative result. The strips are not 100%. I always stress to kids very seriously that these strips have been shown in a limited number of studies to be 92 to 96% sensitive at picking up fentanyl. Those are good numbers, right? But we don't want any kid to miss that, we don't want to miss anybody. So we tell them, even if this is negative, you got to tell someone you're going to use something. You got to tell that person where the Narcan is. So Narcan is an opioid reversal agent, and it comes in a nasal spray that's easily accessible at least in Ohio. I'm not sure the pharmacy rules in Florida, but at least in Ohio, you can get it without a prescription at any pharmacy and also at public health departments. But it's a nasal spray. If someone is, on the ground, unconscious, and you're not sure if they took something or not, or maybe they took something, you can squirt it into their nose, and that opioid reversal agent will move the fentanyl off the receptors in the brain and replace it with the ingredients in Narcan. So the person who might have been barely breathing or slowly breathing or unconscious will wake back up in the course of a couple minutes.
John is saying that Narcan is available without a prescription in Florida. So thanks for that information. And Beth, what you said really is important for every parent to have in their conversations. Discuss with your teen. Tell your teen to have them always tell a friend or somebody else that they're about to take something. That's huge, so that other person, will then know, my friend, what to do if something goes wrong. So I think that's a really important point to make. So thank you for that. And another person in the chat wanted to know, where can we purchase these strips? Sharon, did you want to chime in now?
Yeah,
Sharon from Jewish Family Services.
So, hi, everybody. Thank you so much for all you all are doing. This is what a Narcan looks like. It's a nasal spray. And as Beth had said, if somebody is non-responsive, whether you know they're using or not, or whether you know it's an opiate poisoning or not, this cannot hurt them. So no matter what, this can only help. And the recommendation is that you have somebody call 911 while somebody else is administering this, but make sure that the first responders are contacted. And the fentanyl test strips in our area can be acquired at our local recovery community center. The one in West Palm Beach called Rebel Recovery has them available. And our local recovery community center in Delray Beach, known as Palm Beach County Hub, has Narcan available. Rebel Recovery also has Narcan. So they have Narcan and the test strips, and the hub has a Narcan And soon we'll be having the test strips, but we're pretty new. So
And
Can I
I'm
just-
guessing you also, yeah, sorry.
Could I chime in there? I'm sorry. I want to stress also, I might not have mentioned this, but Birdie Lights, one of our goals, like I said, is to change the culture around this. So for example, as Floridians, I think there's some advocacy that needs to be done in that a teen or a college student, even just because of the stigma or limited transportation, probably can't always get over to the one center that has fentanyl test strips. So what we're trying to change nationally and here in Ohio is to make these so widely accessible. Our goal in the country is to have these in every college dorm, hallway, every fraternity, every sorority. We want the high school kids to know where to go to get them. I mean, my ideal would be to have them in the nurse's office, but I know we got a lot of work to do to get that happening in high schools. But this is something that needs to be moved away from just one location in town, and it just needs to be available everywhere because kids aren't going to seek them out. They want to grab them anonymously.
That's right. They should be at the entrance of bars and clubs and easily accessible. Are they available to purchase online as well, the test strips?
Well, yes and no. There's some manufacturers of the test strips, and it's not clear if their test strips are real accurate. You can get some test strips from Amazon, from this company, I believe, BTNX, but they're really expensive. And in fact, Birdie Light's goal, and I mean, I can send strips to anyone who needs them if you send me your address. But our goal as we get up and running and have more infrastructure and to be honest, more money, is to make a central hub on our website where people can just purchase them anonymously or get them for free. I shouldn't say purchase.
And people can go to your website, which I put a few times in the chat if they want to support Birdie Light or get any other information or so I'm putting that they can also contact you through the website. Sharon, did you have anything else you wanted to share in terms of Jewish Family Service resources?
yes, I had a whole page full of resources, but for some reason, I'm not able to share the content. I did email it to you, Michele, but as I had said, this is it's a very confusing situation because here in Florida, I almost have to think twice because we're so used to treating people for substance use disorder and so used to, accommodating people with, substance use issues or in recovery that we kind of overlook or skip over this crucial need. And isn't just, if you can, as an adult, not even a young person, you might be getting on a plane and your friend might be offering you a Xanax. You don't know where that Xanax came from. I know so many people that actually mothers have lost, and they've been pressed, probably a dozen pressed Xanax pills on our streets. As far as the recovery community is concerned, they are at severe risk, very high risk, because they, of course, are going to go back to doing what it is they used to do. Prior to losing their tolerance. But I would like to be able to offer the Palm Beach County Hub. I'll put it all in the chat. Rails Jewish Family Services, I'll put my direct line in there as substance use outreach coordinator. Also locally, we have 211. That is a helpline that provides immediate service for those in need within Palm Beach and our counties here. Rebel Recovery, like I had gone over. And then there are also Jewish resources for the Jewish community, and don't have to be Jewish, but they certainly are able to reach out to a community that is otherwise very isolated, which is the observant communities who we're finding a big problem with substances. They're also coming forward with it. So there's also Jewish Addiction Awareness Network. And these are all people that are working towards awareness and education and prevention So I'm going to go ahead and put this on the chat, just list them all in the chat. And then please, anybody that needs clarification, please email me or telephone me, and I will be happy to contact you directly with this. Email it
Thank
to you.
you.
Okay.
Thank you very much, Sharon. And thank you, Beth and John. I'm going to open it up now for if anyone has any questions, comments, thoughts they want to share for myself, John, Beth, or Sharon. Please, I'll make a gallery view now. If anyone has anything they want to share or ask any questions, please unmute yourself. Or you can put your question in the chat or your comment.
Michelle, I see a question about school education in conjunction with Birdie Light.
Sure.
So school education is what we do. So we are always trying to connect with school administrators, both high school and higher education as well, to get in front of students. So we've done private salons in people's homes for students. We're doing high school events here in Ohio and a few others around the country. And we have several college events occurring in the next 6 months around the country. So we are trying, our goal is to standardize what we do and to make this part of standardized high school curriculum so that we can be duplicated in every health class across the country. And that's something we're working on, but right now we're just sort of going piecemeal, trying to get in front of as many kids as possible as quickly as we can. So if you know of a high school who'd like us to speak, please let me know.
Thank you.
I just
Hey,
wanted
Michelle.
to jump in on something.
Oh.
Oh, sorry, go ahead.
Okay,
That's okay.
John and then PENINA.
So sure. So I was just going to, I think Jeff had messaged that he said, depending on the amount of opioids ingested, it can take more than 1, 2, 3, 4 plus Narcan doses to reverse an overdose. And that's absolutely true. And in fact, that, Narcan is often continuously administered and even sometimes administered after somebody gets to the hospital. So if it's certainly good, it's better to have more than just one dose, right? And Narcan is, in my experience, it's more accessible than test strips, I would say. I don't know if Beth would agree, depending on the area, but I would say overall it's more accessible. And so there's a lot of agencies where you can get it for free or you can purchase it at a pharmacy locally, but definitely having that, in home. Like I said, I mean, we could put Narcan up our nose right now, and unless we had opioids in our system, nothing would happen. So there's no risk to it otherwise. So.
Thank you. PENINA?
Hey, so I didn't want to ask a question. I really just wanted to make a statement. I wanted to let Beth know. I really had no intention of being on this call. I didn't really think it pertained to me. Opportunity just arose that I decided to listen in. And I think it's really important that you know that I heard you loud and clear. And that while I was listening, I was also texting both of my kids who I don't think have ever done any kind of drug and who I don't think plan to, but I made it very clear to them that I never, ever, that that if they take a pill from someone that they think is a friend, I just don't take pills that you don't know from where they come from. And I understand that conversation is bigger than that about Narcan and everything else, but I at least started the conversation. And I wanted to thank you very much. I can't imagine what you're dealing, how you get up every day. And I appreciate you bringing this to all of us.
Thank you. I also, just to add on to that, I spoke in a group last week, and I just remember a pharmacist who's a parent to 3 teens said that he's telling his kids in a dorm that they are not even to take an Advil from a friend.
Right.
And, perhaps that's unnecessary, but what it does is it hits the message hard to your kids that if someone's handing you anything that looks like a pill or even a recognizable pill, that you go back to your dorm and you get your own Advil, or,
That's
yeah,
basically what I said to them. So, yeah.
Yeah. And, we don't want to ever be too dramatic with our kids because then they stop listening. And I get that. And so and, you know, John said this, we just need to be real honest. And we just need to be clear that we know that it could just take one night that you're heading out for the night and everyone decides to do this one thing on this one night. But the problem for kids now is they don't get second chances. So we got to talk to them about that.
There's a question in the chat. John, you say you have it at home, the Narcan. We have it at home too, but do you think our children should take it out with them when going out?
Sure. So yeah, I mean, I'll jump into that. There's no harm in it, and I think it could only help. You know, I tend to, because I've worked with substance use disorder for so long, I've personally, you know, responded to overdoses, or I'm sorry, you know, accidental drug poisonings, and so I keep it with me all the time. I have some in my car, I have some in my office, I have some in my house. I carry some in my little therapist satchel. So I always have it on me. And there's certainly no harm in having it either, right? I mean, it can just sit in your pocket. Occasionally, we got some weird looks going through the airport with it. But you know, they typically let me keep it. So. But so, you know, so to answer your question, sure, absolutely. They could have it out with them. It can only help.
I would say too that like the college kids I talk to, so many of them are afraid, right? Like this is really scary for kids. And so even kids who never ingest substances, I've talked to them and they're very matter of fact, like, oh, I carry Narcan wherever I go in case I come across a fentanyl ingestion. Like, it's sad to hear, but like, I think that generation is so much more astute about it than we are. Like they, you know, I've been on college campuses where a girl opens her purse and she's like, oh yeah, I have my Narcan everywhere I go. And I wish it were more people, you know, but it's just interesting how practical they are.
I think this is why this is so important. I wish I could do this presentation every week so that everyone out there knows that this is going on and what to do. John, a question. In your experience, do you find that the use of opiates usually starts with pot?
Sure. So that's a good question, and I think it's one that's discussed a lot. And really, I mean, I think the old school term is about it being a gateway substance. And look, I think that for folks that are experimenting with drugs and teens that are experimenting with drugs, they typically do not start with Xanax pills, cocaine, heroin, Percocets, whatever it may be. That's typically not the starting point. I mean, it usually now is a nicotine vape. So it usually starts with nicotine, pot, maybe some alcohol. So, and I think a lot of adolescents, will experiment with pot, but, don't ever, progress to opioids. But if you look back in the substance use history of most teens and adults, sure, a lot of them did begin with smoking pot, but it doesn't necessarily mean that it's going to progress to intentionally or unintentionally using opioids. So I know it's kind of a convoluted answer, but the short answer is, yes, it certainly can, but it's not. It doesn't mean that because somebody has started smoking pot that they're necessarily going to progress to that.
Any other questions for our panel this evening?
I just wanted to add one more thing, unfortunately, that has come to light lately, and that is in the kava shops, there's a tea or some sort of drink called kratom, and it does attach itself to the opiate receptors. And so when people have found themselves with a dependency on that and have sought help, they have come up positive for fentanyl. So this is, it's like Beth had said, it could be, someone could be out looking for something to speed them up, and there could be fentanyl in it. They could be looking for the opposite effect, And for whatever reason, fentanyl has been added to the substance. So
Which is a great,
yeah,
this is a great segue, Sharon, to our next question is, what are the symptoms in case child accidentally takes fentanyl? What is it that, what happens? Who would like to answer that one?
Well, an opiate poisoning is a respiratory failure. So the breath slows down. Usually people talk about kind of a gurgling that they hear, and obviously the person is non-responsive. When you're talking about Narcan or learning about Narcan, I would recommend that you go to YouTube, and there's like a little training there. So there's a training there that shows what it is. Sorry, someone's a training that shows what a Narcan overdose looks like and what it is to do to help someone who's overdosed.
Or not overdose, just accidentally ingested fentanyl.
Yeah, exactly.
Sure. And yeah, and if I can just jump in there as well. So as far as like signs of an overdose or like accidental drug poisoning, right? So people will generally, their lips will start to turn blue. Sharon mentioned the muffled breathing. So if there's any physicians around, they may know how many breaths one typically takes in a minute. But if you're suffering from that ingestion of fentanyl or another opioid, that amount of breaths may be down to 1, 2, or 3 per minute. People are often cold to the touch, right? And so those are some signs and symptoms. And as was mentioned before, if you suspected at all that it could have been opioid or fentanyl ingestion and there's Narcan, just administer it. It's not going to hurt them. If it's some other type of medical condition or some type of issue, just go ahead and administer it anyway, because it's not going to hurt them.
Thank you, John. One last question in the chat. At what age is it appropriate to begin these conversations with your children?
In middle school.
Yeah. I mean, I was going to say middle school, probably. I mean, certainly you can have it before, but I think conceivably you could start at 10 years old, right? But I think what's more important is continuous conversation and check-ins, throughout, the childhood, because I mean, kids can have a short attention span at times.
And I would also say that there are people on, kids on social media, and there might be some, crazy people out there that are selling candy. I've seen that before. And so you can have those conversations of never to buy anything online from anyone, never to even talk to a stranger on social media. These are how these things begin. And if you have a kid that's on access to the internet or, on their phone or access to these social media platforms or these other things, that it's never, you have to have these conversations about this, correct?
Absolutely. Absolutely. And at that age, you need to be monitoring, because, the dark web is just, it's just, so dangerous for these kids. And it's a very dangerous substance, very easy to become dependent upon it, even if it is just that, before next thing you know, they need treatment.
Well, thank you very much. Does anyone have any last questions or thoughts or comments? Well, I just want to thank John Puls for joining us tonight. Beth Weinstock, thank you so much. And Sharon Burns-Carter, thank you so much. And for more information, you can go to birdielight.org and to Jewish Family Services. And you can also reach out to John Puls if you want to put your website in the in the chat as well. Sharon, you can do yours as well. If any of your contact information, please put in the chat. I also want to thank the Bertush Make a Difference program, which is B'nai Torah's substance use outreach program, who supports all of these workshops and presentations. And to the Weinstock and Deutsch family, our hearts are with you, and we send you prayers, and we Beth, we hope that Birdie Light it goes nationwide, global, because it is so important. So thank you for what you're doing.
Appreciate it.
Everyone have a wonderful evening. Thank you so much for joining us tonight.
Thank you.
Thanks, everyone. Take care.
Bye-bye.